Hi everyone, my name is Zoe Estrada and today I'll be discussing my personal philosophy of nursing. When I first read this assignment, I realized that creating a personal philosophy in nursing required me to reflect beyond just the skills and knowledge I've gained in nursing school. It required me to think about my personal why. Why did I choose nursing? What values do I want to carry with me into my practice, and what kind of nurse do I hope to become? My philosophy of nursing is centered around the belief that nursing is the combination of knowledge, compassion, advocacy, and human connection. To me, nursing is not only about treating a diagnosis or completing a task, it is about caring for the whole person, their physical needs, emotional needs, values, fears, and experiences. One of the core values that guides my nursing practice is compassion. I believe compassion is what allows nurses to truly see their patient as individuals. Every patient has a story that exists beyond the reason they are in the hospital. They have families, responsibilities, fears, and personal experiences that influence their health. As nurses, we have the privilege of being present during some of the most vulnerable moments of a person's life, and the way we communicate and care for them can make a lasting impact. My personal experience have shaped this belief. When I was younger, I experienced being a patient in the hospital myself. At 12 years old, I was hospitalized due to a severe nosebleed that required medical intervention and blood transfusions. During that experience, I remember how much it mattered to have healthcare professionals who advocated for me and helped me feel safe. That experience gave me a deeper understanding of what it feels like to be on the other side of healthcare, and it continues to influence the nurse I want to become. I want my patients to feel heard, respected, and cared for. Another important part of my nursing philosophy is patient advocacy. Nurses are often the bridge between patients, families, and the healthcare team. Advocacy means speaking up for patients, protecting their dignity, and ensuring their concerns are not overlooked. I believe every patient deserves equitable and respectful care regardless of the background, circumstances, or choices. A concept that strongly influences my practice is patient-centered care. Patient-centered care means recognizing that every individual has different needs, beliefs, and goals. As a nurse, my role is not to judge patients, but to support them, educate them, and provide care that respects their autonomy. Every person has the right to participate in decisions about their own health, and nurses have a responsibility to provide the information and support needed for patients to make informed choices. Ethical principles also guide the way I practice nursing. Respect for autonomy reminds me that patients have the right to make decisions about their own care. Beneficence and non-maleficence remind me that action should always focus on promoting healing and preventing harm. Justice reminds me of the importance of providing fair and unbiased care to every patient. These ethical principles create the foundation for safe and professional nursing practice. Professionalism is another value I believe is essential in nursing. Nursing requires accountability, integrity, teamwork, and lifelong learning. Healthcare is constantly changing with new research, technology, and treatments developing every day. Because of this, I believe nurses have a responsibility to continue learning and using evidence-based practice to provide the safest and high-quality care possible. Evidence-based practice is important to me because nursing decisions should be supported by current research, clinical expertise, and patient preferences. It allows nurses to provide care that is not based only on routine, but on the best available evidence. As a future nurse, I want to continue growing, asking questions, and staying open to learning throughout my career and every experience. My journey through nursing school has also shaped my philosophy. Nursing has challenged me, but it has shown me the importance of resilience, perseverance, and believing in myself. I have learned that being a nurse is not about being perfect. It is about willing to grow, adapt, and continue showing up for your patients and your team, and most importantly, yourself. The qualities I hope to bring into nursing are empathy, attentiveness, and the ability to make people feel seen and heard. I believe small moments of kindness can have a powerful impact, whether it is taking an extra moment to listen, explaining something clearly, or simply being present. Those moments help build trust between a nurse and a patient. In conclusion, my personal philosophy of nursing is that nursing is a profession built on compassion, advocacy, respect, and lifelong learning. I believe a great nurse treats the illness while never forgetting the person experiencing it. My goal is to provide care that is safe, evidence-based, ethical, and centered around each individual patient. I want my patients to leave their healthcare experience knowing they were not just cared for, but truly seen and valued. Thank you for listening.